Well, we have another session now to talk about questions that you've sent in to me here at Isle of Man Television to do with the COVID situation and the Minister for Health and Social Care every week. It's either Sunday or Monday, and we are recording this at 1:05 on the Monday ahead of a press briefing at 4, which is, if you heard our last section, it has potentially some interesting information, but we're not privy to that at this stage. Anyway, Mr. Ashford, hello.
Good afternoon, Paul.
Here we go then. I wonder if you could clarify whether drivers of commercial vehicles with passengers should wear face masks.
Yes, they should. They should be wearing face masks. So things like taxis, the taxi drivers should be wearing face masks. There may well be medical conditions as to why a particular driver can't, because drivers are exactly the same as the rest of the population. But where possible and where it's medically appropriate, then drivers of commercial vehicles should be wearing face masks.
This one's been in for a few days, so it might have changed. We as a family were asked by 111 last Thursday to isolate because a 10-year-old son had been in contact with a pupil who had tested positive. We were told his test would be Saturday or Sunday. It's now Tuesday and still no test, despite numerous calls and emails to 111 and contact tracing, and to yourself. He has since been in hospital with an ear infection. And a few of these will be the same sort of things about timings and pressure, I suppose, on the systems.
Yeah, as we explained last week, Paul, there has been pressure on the 111 system. My understanding is that pressure has now started to alleviate. We were expecting it, and there was a backlog. And as I said at the last briefing, we do appreciate people have had to wait. Unfortunately, while 111 arranges the tests, because they've also got to do the contact tracing back and contact people and tell people to isolate. So it's been a matter of 111 balancing priorities around getting people isolated, then tested, but also equally going back after the results of those tests and making sure that they isolate anyone who's required to do, so there isn't any other further transmission chains, which would actually create even more work for 111.
I've heard of a couple of cases that contact tracing were only going back a couple of days now for positive cases. How can this be the case when we know that Dr. Henrietta explained the incubation period can range up to 14 days? We're only a week into lockdown, so still seeing cases from pre-lockdown coming out. So surely contact tracing should be going back 14 days when island life was still normal.
But contact tracing isn't an exact science. It doesn't apply the same to every single case. So in some cases where you've got people who deem low risks, they go very few places, they don't tend to have much interaction, and particularly now we're in a circuit breaker when people aren't supposed to be moving around that much, they will go back maybe 48 hours. In more high risk scenarios, where it appears the only way the person can have attracted it is, say, from attending large-scale events or something like that, then they will go back further. So it literally depends upon what comes out of that initial contact tracing purposes, and whether the person themselves and the way they act is deemed low risk or high risk. So in some cases they will go back a week or even further than a week, but it depends upon that initial conversation with contact tracing. So in some cases it is correct, they will only go back the 48 hours, but that's dependent on circumstance.
This next question I've had similar before, but I think it's still current. My husband's a pilot, so you can imagine the year of permanent isolation that we've been in basically as a family. Since December we had to isolate separately from me and the children. We're told that isolating away from your household and the 14-21 day isolation regime was a temporary measure over Christmas for the students returning, and whilst the virus was so prevalent in the UK. Over 3 months later, he still can't isolate with the family despite his heavy regulated industry. It was deemed not acceptable for steam packet crew to live in permanent isolation, yet there are many families like us continuing to be kept apart.
Well, my understanding, Paul, is under the current rules, and I'm happy to be corrected if I'm wrong, but key worker families can isolate at home. UK key workers, they are allowed to isolate with their families, and that is the case. They don't have to isolate away from the home. That's certainly my understanding of the rules anyway. In relation to the isolation away from home, it was originally intended as a temporary measure. I've got to be clear, it had nothing to do with the students. It was to do with the general situation in the island. Then obviously we had the outbreak in January, which changed things, and now we've had an even bigger outbreak as we got to the end of February. So it would be very remiss at the current time, when we've got chains of transmission, when we've had household spread, to be actually trying to change that rule. So when it came in December, it was hoped it would be a temporary measure, and we would then be able to go back to people coming in and isolating at home. Unfortunately, as with all these measures, as I've constantly said, things change day in, day out. And unfortunately, that's one that has been overtaken by events.
The exact definition of local unknown source on the COVID dashboard, please. I take it to mean that these are non-travelling cases from the long line of cases that originally came from an unknown source.
So they are basically where they are local cases. So the person hasn't travelled, they've not travelled at all, and there is no contact tracing has been unable to turn up any link to any other chain of transmission. That's an unknown source. So basically, if you reported to MOSE, Paul, to 111, you had symptoms, you got tested and were found positive, you've clearly not travelled, and then from the contact tracing of where you say you've been, that doesn't link with any other known case, then that is an unknown source.
I have several medical conditions now, each one in a high-risk group of the COVID virus scenario. Each one, though, is probably at a level not deemed medically extreme, but put together they must be. I'm taking this person hasn't been called yet then.
Well, if this is about vaccination, then they need to have a conversation with their GP, because it's the GPs that draw up the list as to who is clinically vulnerable and who is extremely clinically vulnerable. It works off the primary care records and is a manual process because it's based on the person's conditions. The JCVI does set out a list of conditions under each of those categories that make someone vulnerable to COVID, but I would suggest the person needs to have a conversation with their GP. It's not all medical conditions. Because you have a medical condition, that doesn't necessarily mean you're more susceptible with COVID. It's specific conditions, so it would depend whether the person met that criteria, and it's something they'll need to discuss with their general practitioner.
I didn't get a vaccination letter till last week, and today got offered one at the airport, but we live next to Chester Street Hub. I turned that one down and asked for Chester Street, and now I'm on a waiting list. My point is obviously not to be awkward, but for the sheer craziness of it all. To protect myself and to help a little with not doing needless travel, if I could go by bus and then put myself at greater danger than just going to the hub. I mean, they can walk there. I think they carry on.
Yeah, 111 will book the next available appointment for someone. So as they're going through the list, they don't look at geographics necessarily. They will always try and slot the person who's registered into the next available appointment. So in this case, it sounds like the next available appointment was at the airport, even though geographically the person is close to Chester Street. As the person said, they've contacted 111 and said they want Chester Street, but that will probably mean they will have to wait, because it sounds like the existing Chester Street bookings had already been slotted in and completed at the point they registered.
The next one is very current, and the mailbag is full of it over the last 24 hours. I know you've already been talking about this today in the media, but about the safety of the vaccines, the particular one that 5 countries now stopped giving out. I mean, you've said it already. Any update, or will there be any updates on this?
No, Astrazeneca is still certified as safe for use. The UK regulatory authorities still say it's safe. The European Medical Agency has been looking at this. After reports, they've been looking at, I think it's 30 cases out of 5 million vaccines in Europe that have been administered. That's actually lower, as the EMA themselves has stressed, is actually lower than you actually see in an unvaccinated population in terms of what you would expect to get blood clots. The same with WHO as well. The World Health Organization has looked at this and has said they have no concerns over the use of AstraZeneca. They believe it is perfectly safe for it to continue to be used. I think one of the important things we've got to focus on is when someone gets a vaccine, and particularly when you're vaccinating older age groups in the community, people do still naturally get ill. So you may remember, Paul, about a month or so ago, there was a big news story about deaths in Norway and Germany after the Pfizer vaccine, where people were saying these people had been vaccinated and then died. They were all looked into, and no causal link was found in any death to the vaccine. Unfortunately, that bit of the story didn't generally get reported in the international media, only the initial part. And as AstraZeneca, like I say, there is no evidence whatsoever of it actually being the causal link for these thromboembolic events.
I take your point, but I mean, 5 or so more countries now have stopped it, so they think there's some problem, right?
Well, no, they don't actually. The country got to be very clear what Ireland has actually said. She said Ireland hasn't said they believe there's an issue. They've said they are precautionarily pausing. The European Medical Agency, the World Health Organization, the UK regulators say there is no need to do so. In fact, actually, just to flip the argument, like I say, there's been 30 cases that, or I think it's 33 in total, that the EMA has been looking at out of 5 million vaccines delivered. That's actually less than you would see in an ordinary unvaccinated population. You could actually flip the argument and say AstraZeneca prevents blood clots because the people who've been vaccinated have ended up with less blood clots than the unvaccinated population. Now, of course, there's no scientific basis to say that either, but equally there's no scientific basis to say that AstraZeneca causes that blood clotting event. So it's just to show you can actually flip the argument if you so wished, and it would have equally no scientific founding.
I'm sure that one will keep going there, won't it? Anyway, I'm just seeking clarification over the self-isolation period we're currently under. I was identified as a high-risk contact after having been supply teacher at Ballasalla School. On day 0, my son is at QE2 school, year 7, and was also identified as a high-risk contact, as I believe all the children who attended on Monday were. He doesn't know either of the boys and doesn't have any classes with either of them or sitting next to them. Fortunately, both our tests returned negative, and whilst I know that the incubation period can be longer, all 4 of us remain asymptomatic on day 10 since possible exposure, so I'm hopeful that our exit test will also be negative.
Yeah, if the person's exit test is negative, then that means they go back about their ordinary business as normal.
All right. Next one we've had time to time, and I've had quite a few different versions of this one in again, just saying they're worried, concerned about this person's partner and the work colleagues. They work at a certain place. There's quite a few of them there. They cannot socially distance as they always have to pass someone to move around the factory. 1 bottle of sanitizer at the door. That's been there since the last lockdown. No masks supplied. They had to bring their own in. No track and trace book on the premises.
Employers have a duty to ensure that their work premises are safe, and that includes, where possible, to maintain social distancing, and where that's not possible, to introduce mitigation measures such as use of PPE, and enforce that use of PPE to ensure their employees are safe. If someone feels that's not being done, then they need to report that through the Health and Safety at Work executive within DEFA. And they should be actually contacting and making that sort of contact to express those concerns. Employers, like I say, they do have a duty for the welfare of their employees. There will be employment places still open. Manufacturing is a big one where social distancing may not always be possible, but there should be risk assessments and mitigations in place that the employer should have. And if anyone's concerned about that, like I say, I would urge them to report it.
I'm surprised that question keeps coming up by now. You think that people would take it upon themselves to talk to management or club together to say we're not carrying on. But anyway, we'll see what happens.
Or report it through the official channels,
Indeed.
Paul, like I say. Yeah. If that concern still exists, then people really should report that.
Why are we not allowed to fish during this circuit breaker? The lakes are all pegged out evenly, with social distancing being at least 10 metres between each peg. We are outdoors. This is very good for our mental health, being able to fish and relax. I've written to the government with no response on 2 occasions, but golfers are allowed to play on their own outdoors. To me, this is exactly the same.
I'll be perfectly honest, Paul. I'm not aware that fishing isn't permitted if someone is on their own.
Right, I don't know, and golfing as well.
I'll be honest, I'm not aware that that's not the case.
Okay. Can you ask why during the lockdown borders have not been raised to level 5B? This has come up every time. I'm sure you're sick of answering this, but I'll ask it again.
No, it's always good. It's always another good one to get out and remind people. The reason being level 5B was of its time. Since then, things have moved on and things have developed. So realistically, there is nothing really benefited by moving to 5B. Travel numbers into the island are exceptionally low, as you would expect with the island being in lockdown, and are still not allowing anyone who's not resident to travel freely. We now have the 3-point test in place as well, so anyone coming back must undergo the 3-point test or must do the 21 days isolation, which wasn't in place when we had the level 5B. So at the moment, there is, although it was of its time, it doesn't actually give us any real benefit. It doesn't assist with the situation at the moment by doing that.
Do they know if any of those who received their first vaccination has subsequently gone on to contract COVID-19?
We don't and we won't. And the reason being that the vaccination forms part of someone's personal medical record. So unless they voluntarily come forward and actually say to us, we've had the vaccine and we've contracted it, we don't have the legal right to go trawling through people's medical data without their express permission to do so. So this was asked, I think, at the briefing by one of your colleagues last week, Paul. As Minister, I won't have that information because I have no right of access to people's personal medical data, and whether someone has been vaccinated or not just in relation to COVID, but any normal vaccine, is part of their private medical data. So we do not have that information, and it's not something we could legally compile either.